Okay, this video is going to show you how to use the thin slices of the TAVI scan, which is these 4,864 images at 0.63 millimeters thickness, to make the images for the annular analysis and for rounds. So we know that NCSLE was 45 based on the earlier assessment. We're going to pick 5 to 45 and we're going to load them to the TAVI1 workflow. I will start at 25% phase. I've also gone through the case beforehand to figure out when my peak annular distension phase is, and it also happens to be the 25 phase. So I'm going to 25. I'm windowing it so I can see a little bit of the calcium. I'm using the alt click onto the plane of the annular, the aortic annulus, like this. And I'm scrolling down on the short axis till I get to what I believe is close to the right coronary cusp nadir. I'm going to scroll back and forth until I get truly the lowest point of this cusp. I'm going to alt click onto it and then grabbing these circles on the green line, I'm going to try and locate the non-coronary cusp nadir. The blue line will intersect with the interatrial septum close to the non-coronary cusp nadir. I'm looking at this tissue, just how thick it is, and also seeing the cusp, the sinus tissue as it comes down here. And I want my pink line to be just underneath that. I think this may be the lowest point in that nadir. And I want my pink line to just touch the inferior aspect. I'm using my pen to move the root across. Similar kind of story here. See the tissue coming back up as the sinus, leaflet tissue connecting to the sinus. And again, my pink line is just touching what I believe to be that. I'm scrolling back across and I can see the same. And now I'm on both these nadirs. I'm using the pen to position it in the middle. I'm going to zoom of 5. And I'm hitting Control P, which for me is the polygon tool. And as I'm drawing this polygon, I want to be touching the bright of the contrast enhanced lumen, maybe just like a couple of pixels away from the dark of the annular tissue, as per the Jack 2019 guidance paper on CT analysis for TAVI. If you try and go straight to touch the annular tissue, you'll probably end up getting too high an annulus number. So I'm getting 3.9, basically 3.87. And I've already done some pre-analysis that tells me that I'm consistent in that number. I'm using the annulus tool, hitting this button, and then pressing Alt-D. And I'm going along the long axis of this annulus to draw this circle. And it will snap to most of the annulus. So I'm going to pause the video. Okay, some pointers on the annulus. This is an important image to get right. The polygon that we created earlier with the red line here with the Control P command. We want to make sure that this is convex or at most usually like flattened in places. To have it concave at any point introduces error because these valves have strong tensile strength either through self-expanding or balloon expandable means. So creating a concave contour is going to create problems for your perimeter number. It's going to go up, falsely go up. So try and keep it convex, or in areas where you can't do that, flat at most. only with some small exceptions along the way. So I have kept it nice and convex, and in other areas flat. Right. The next thing is I have adjusted this curved annulus tool to make sure that it is matching the area. And it usually gives me a perimeter that's slightly less. I make sure that on the options level, I have saved it as default to a scale of smoothing of 5 millimeters. And you should make sure that that is the case with when you do your analysis. I'm also going to adjust the long axis measurements so that it is running through the centroid point of this annulus, like so. And this other measurement should be perpendicular. Next, I'm adjusting my zoom to 3.5, actually to 3 probably. And I'm positioning these measurements over here, and I'm moving this one off screen to just to not have any confusion regarding the perimeter. I'm going to select for embedded geometry and S3 Ultra 23 for this patient. And I'm going to make this half. It's going to sometimes take me off plane like this just did. And I'm going to go back to my annular plane with the virtual valve in place. I'm going to hold on my Alt button and my left click button, and I'm repositioning in the center of the crosshairs. I'm right clicking here, linking to 3D. So these two match. Windowing so I don't see any of the liver. Repositioning some of these labels so they're out of the way, but still visible. And I'm going to drag the valve down by 2.7 millimeters, which is 15% below the virtual basal annular ring plane. Using the blue line as a guide. I'm going to zoom in a little bit so that I have more control over this positioning. Yep. And now I'm going to unzoom here. And now the valve's position, I can delete this measurement. I don't need it anymore. I have my calcium score from earlier. I'm going to go to MIP. I'm going to go up. I want to see this valve in kind of all its maximum calcification. So scrolling up and down a little bit to see that calcium. And to get this picture here, I'm going to type in and start taking images. So I'm going to select my output panel so I can see that for now. Create an all-in-one by pressing Control Alt C, and then turning crosshairs off by pressing X, and then C again. And I'm going to go back using my undo function to go back to my annular plane. Okay. And then I'm going to select the embedded geometry tool. I'm going to take a picture here of the annulus. I'm going to finalize it. Snap another picture. I'm going to get a measurement of the left main above the annulus. And I want to see it, see this red line parallel to my valve body, because that is a straight valve with the S3. Rotating around to get my right coronary in the picture. And once that ostium is in picture, I'm going to draw from there to the annulus. I'm going to rotate back around to get my left sinus height. And I want the maximum height of the sinutubular junction above the annulus. rotating back around to get my right sinus height. Again, the maximum sinotubular junction height above the virtual basal annular ring plane, rotating back around, watching over here to get my non-coronary cusp height. Now I'm going to undo the finalize. I'm going to rotate back around. So my blue line now intersects with the membranous septum. As this line intersects, I'm going to watch over here to see the lowest point in the membranous septum. And it is often somewhere close to the interatrial septum. See my blue line intersecting with the interatrial septum. Now it's obviously gone too far, and I'm going to pull it back, and I'm watching this area here to see the lowest point in the membranous septum. It's usually also the thinnest point, but it doesn't have to be. I think this may be it. I'm going to use this line segment 3D straight tool. I'm going to hit here and double click here, minimizing this number, and I'm scrolling down. And now it's gotten thick, so I'm coming back up a bit. Fine adjustment with the middle mouse. And I'm going to take a measurement from the red to the pink. I'm taking a snap of that. I'm going to hit undos until my line segment 3D straight measurement disappears. And now I'm going to scroll up to the sinuses of Valsalva. Again, trying to get the maximum from those sinuses. And at this point, I'm going to get my sinus to opposite commissure measurements. And I can see the average is going to be well above 27 millimeters, so I'm not concerned about this number. We had a perimeter of 70.6 earlier when we got the annulus, which means we're in the Evolut FX26 range, which means we need 27 millimeters in terms of the sinuses of Valsalva average dimensions, and this is well above that. If I had any concerns that we're going to be below that, I would go to the diastolic rest phase, which is where we would take those measurements if we were definitely doing an evolute. But in this case, I'm quite happy to accept these numbers. I'm going to do a finalize. Turn the crosshairs off. Picture. I'm going to get a one shot of the left main ostium and then the RCA ostium. And I'm going to hit undos until I get back to this level. My crosshairs are back on. I'm going to rotate my green line so that it is now parallel with my right to opposite commissure line. I'm going to hit undo finalize and right click over here, link to 3D to start getting my projection angles. Scrolling down now, I'm watching the right cusp. And I want this green line, which is my image intensifier line, to ideally pass through my right cusp nadir and be equidistant from my left and non-coronary cusp nadirs. And it appears to be. I'm going to also check here. And it's on my right cusp nadir. And it seems sort of equidistant from my left and non-coronary cusp nadirs. I'm going to change the zoom to 1. Push this off screen so there's no confusion regarding the perimeter size. And then I can label this three-cusp view. Snap there to show where my green line is pointing. Take one of the three-cusp view. It is close to the descending thoracic aorta. I'm going to scroll backwards and show you what would happen and how that valve would be partially overlapping the descending. We want one that is free of the descending thoracic aorta if our three-cusp is not free of the descending thoracic aorta, and something that's ideally 25 degrees or less for either RAO, LAO, or coil cranial. Now I know I'm free. I'm going to take another image here, call it clear. I'm going to move this thing around, and I want to see my left and right cusp nadirs and see where they disappear. And I'm just going to make a slight adjustment here so that an imaginary line connecting the left and right cusp nadirs as they disappear is parallel to my green line. And ideally also running through the non-coronary cusp nadir over here. Okay, so we're back on annular plane, which is where we should be taking this picture so we can get a good idea of the relation of the descending thoracic aorta. I take one more picture here, and I'm going to label this left plus right overlap. I usually like having my clear angles first, followed by my three-cusp view. Obviously, if my three-cusp view is clear of the descending thoracic aorta, I don't need to do that extra clear image. At this point, I'm going to send just to local server, and click OK.